question from a caregiver who actually wanted to come tonight, but they
Sure.
couldn't make it. She had said that her husband has been on Keppra for 2 years, and recently he started complaining of foot numbness, and she was wondering, what should we do?
Is he on a lot of other medications too?
I'm actually not sure.
I think that, something like that, they should refer to the doctor, because someone, you need to know the complete picture. And that's why that's so important.
Especially with new neurologic complaints, and you have to worry about you have to look and not blame it on the medication, make sure there's nothing else going on. Especially,
you go up there for
Yeah.
questions with Gail. Yeah, thanks.
sorry. No, what I was saying is any new neurologic complaint outside of treatment, I don't think should, especially in a history of brain tumors, be blamed on the medication without proving otherwise. For example, people can have recurrences, people can have long-term effects of radiation and chemotherapy, people can have neuropathies and things like that. So I think, not necessarily blaming it on medications that you're on, but getting a full evaluation when you have new neurologic symptoms is always the best advice. And I just wanted to corroborate a couple of things that Gail was saying. So one of the most common scenarios where someone who's on medication might have a seizure is sleep deprivation and stress. So people who are going through this unfortunate circumstance of dealing with brain tumors, dealing with the treatments, dealing with all of the things that are associated with post-diagnosis, it's stressful. The medications, like Gail was saying, the steroids, it can rev you up. It can make you not sleep at night. So things like exercise, anything that can get the stress out of you is very important for overall health, and especially with seizure control. Any other questions?
Gail, do you have any tips for general side effects? I mean, are there anything people can do, to eliminate, naturally, to help with that? I know that with pain medicines, you have to take laxatives because you get backed up, or, I don't know, is there anything for the general seizure kind of medications that you can take to alleviate?
Well,
Not medicines, natural, or what are some typical things?
sometimes scheduling the medication so that the side effect is beneficial rather than a negative. If it's something that you take once a day and it makes you drowsy, then take it at bedtime. Or if it's something that maybe gives you some indigestion, then try and take it after you eat. Other than that, not really. And trying, again, resting as much as you can, just being good to yourself.
Because I think a lot of the side effects, unfortunately, the medications are directed at your central nervous system. So if you're going to feel dizzy, there's not really much you can do about that in itself. But a lot of times, your body getting used to it will, if you give it enough time. So in that interval where you're getting used to medication or getting used to an increased dosage, just give yourself enough time and enough safety built into your life. Like, for example, if you get dizzy, make sure when you get up, sit for a while. Don't just get up suddenly in those critical periods, because that is when you could potentially fall. And then typically things like the dizziness and the sedation, people get used to, and they eventually go away. And unfortunately, it's one of those medications. It's like this risk versus benefit. Like if it's protecting you against seizures and you're having some side effects that you just have to learn to deal with, for example, if it's dizziness, always when you're changing posture, give yourself some time. And that has to become something that, people are just on the go. People are automatic about, but you have to give yourself time. So those kind of things you can do in terms of at least preventing further injury.